Oh, thank God for joining my sis back home. But just before I step out of the car into the house, let me quickly talk to us about something. I would like to share something about chronic kidney disease with us. In case you're someone who already has chronic kidney disease or you do not have chronic disease but looking for how to protect your kidneys and keep them healthy, you're in the right place. Okay? So, what is chronic kidney disease? That's a disease condition where there's a progressive damage to the kidney leading to loss of function. Let me briefly remind us of the functions of a kidney. The kidney is that organ that helps us to flush away toxins and waste from the body. It also helps to take out excess water through urine. It is that organ that helps to produce hormones that also help in producing red blood cells. Okay, the kidney also helps to convert vitamin D into the form that the body can use. Okay, now at this point, I have bad news and good news. So, which do I tell you first? Let me tell you the bad news first so that when you hear the good news, it can reduce the pain of the bad news. Okay, so the bad news is this: there are some things that makes you at risk of chronic kidney disease which you cannot avoid. So, what are those things? You have family history. Once someone in the family has had chronic kidney disease, it's very likely, the possibility is very high that someone else from the family is also going to come down with chronic kidney disease. So when you have histories like this, make sure you relate to your doctor. Okay, that's why I always encourage people. I'll keep singing it into our ears until we get used to it. Let's prioritize routine medical checkups. Please don't allow any year to go in your life without going to the hospital at least once or twice just to go check yourself out. Because the truth is, so many diseases, you get to find them out in time and you treat them early, and the outcome is better. I'm sure you're getting value at this point. So why don't you like this video, share it, and also subscribe to my YouTube channel. Do well to follow me on other social media handles on Facebook, Twitter, Instagram, TikTok with the same handle, Dr. Uzumma, Uzumma. Welcome back. Now, other causes of kidney disease could be already existing medical illnesses like diabetes, hypertension. So that is why it's very important to have a good control of your diabetes, that's if you already have one, or hypertension if you already have one. And if you don't, do well to avoid things that could lead to these medical conditions. But if you're already hypertensive or diabetic, please follow your doctor's instructions and your management plan so that it doesn't lead to complications, which is chronic kidney disease. Okay. Another thing that could predispose someone to having kidney failure would be long use of some drugs or abuse of some drugs, especially over-the-counter drugs. Here you have your non-steroidal anti-inflammatory drugs first on the list because that's the commonest over-the-counter drugs which people go for and tend to use over a long period of time. By over-the-counter drugs, I mean drugs you go get for yourself without prescription. So at this point, I would love to advise against self-medication. Please do not go for self-medication. It's very wrong. Always talk to your doctor about any health concerns that you have. Okay, next thing you need to stop because they predispose you to having kidney diseases is smoking. Please stop smoking. Stop. I've also talked in our previous video how you can stop smoking because it has to be on a gradual process. You don't just wake up one morning and say you're stopping smoking. Go to my YouTube channel, you will see a video on where we talked about how to stop smoking. Okay, do you know that at the early stage of kidney disease, there are no symptoms? But as the disease progresses, you begin to notice symptoms, which includes, in no particular order, please, nausea, vomiting, loss of appetite, sleep disturbances, anemia, shortness of breath, um, swelling of the feet and ankle. Let me remind you that there are so many other medical conditions that can present with the above mentioned symptoms. So how would you know what it is for? When you notice any of these symptoms, is to go to the hospital and talk to your doctor about it. He would do a further investigation to know what disease condition it is. Okay, it's always good to report to the doctor at the first sight of any symptom. Any or all of the above mentioned symptoms, there is none that is pleasant. Okay, so you would want to always tell your doctor about it. Remember, the earlier the better. When you find out something on time and report to the doctor and start treatments earlier, you're sure to get cure and also have better prognosis, and you would avoid complications. So when you get to the hospital, the doctor would do blood work, or most times when you even go for routine checkup, just a blood test could point out that something is going wrong around the kidney or in the kidney. And when the doctor discovers this, they would now refer you to a kidney doctor, that's a nephrologist. Okay, so the nephrologist will do a more detailed investigations, including a urine test, ultrasound, CT scan, biopsy, to know exactly the cause of the disease, of the kidney disease, and also treat you appropriately. I would also want to encourage anyone who has come down with kidney disease to do well to follow their treatment plans very well to the end. Good news, there are things you could do to slow down the progress of kidney disease if you already have one. For example, if you're hypertensive, you have to manage your blood pressure very well by taking your medications the right way, the right time. And if you're diabetic, you have to have a good control of your diabetes, because if you don't, these things could lead to complications and worsen the kidney disease. Okay, you also want to maintain a healthy body weight. It's very important. So do well to also check my YouTube channel and go through the video where we talked about mastering the art of weight management. Because in all these things, in every disease condition, obesity has a way of making it worse. So do well to maintain a good body weight. When you go to the hospital, the doctor would place you on a good treatment plan. Please do well to follow it just as your doctor has said. Okay? The treatment here could include diuretics to reduce swelling. You could get some supplements for the anemia. You could get statin to help you control cholesterol. You could also get some medications to help protect the blood vessels. And you would also have to cut down protein diet. You have to go on low protein diet. So my people, I would love to conclude with this advice. Chronic kidney disease is not a death sentence. If you go early to the hospital and follow your treatment plans. Okay? So do everything that we have talked about today, put them into practice, and I'm sure you're going to be fine. Thank you for watching today's video till the very end. If you have any questions, feel free to drop it in the comment section or send an email to my email address, which is in the description box below. And always know that I am here for you. Please take good care of yourself, keep staying healthy, and know that Dr. Yuzi loves you. Do well to like this video, share it, subscribe to our YouTube channel, and follow us on all other social media handles: Facebook, Twitter, Instagram, TikTok, with the same handle, Dr. Uzumma, Uzumma. Thank you and see you in our next video. Bye for now.